get entered in. I'm gonna drop a couple dollars on this because I would love it. I deserve a trip. You deserve a trip to Puerto Rico. So for our 5th year anniversary, $55, donate, grab that QR code right now. You guys think I'm playing. You know, a lot of people do that, right? We're not playing around here. We're saving lives here. We're doing it. Touch has been doing it for 5 years, y'all. But look at this. This is me going to Puerto Rico because I had just donated $55 to help save somebody's life, and you can too. So please, yes, clap it up. Clap it up for yourself. Look, when you guys see me, Whitney Tabor on the beach, girl. With my breasts, my black breasts looking good on the beach. Okay, because that's what we're doing. We're here to celebrate and make sure we keep those things going. Okay, period. So we're gonna get back into it. I'm very, very excited again to have you all here. Touch Care, we're gonna talk about Touch Care, right? Touch Care is Touch's patient navigation program that currently works to optimize the clinical trial patient experience for Black blesties, right? Make some noise for the blesties, okay? Yes! Our team works with pharmaceutical partners, researchers, and investigators to curate patient-centric trial experiences, right? Again, we just saw an amazing panel that had everything to do with why us being a part of these clinical trials is very, very important. So thank you so much to the Blesties for doing the work that we need to keep us all safe and alive. We also partner with Unite for Her to offer care for her each October, right? That's what we do. October, we wear pink all the time around here, y'all. But October is we turn up in October. So this campaign is to seek to educate about breast cancer health disparities and the impact to figure out the care that we need, y'all. Okay? And they're literally culturally tailored to making sure that those clinical trials and the drugs that we need are going to actually be effective. So very, very, very important work that they're doing over there with the Blesties and the Touch Care community and the people. Very, very excited though to check out this next panel that we're going to do. This is going to be from Touch SA. Listen, Haley, I always need my backup. Haley, am I saying it? SABCS? Yes. SA, okay? Okay, I was going to say, listen, don't let me look crazy up here. Check out this word cloud from Am I just saying stuff and y'all know? Okay, perfect. We're here. Teamwork makes the dream work, y'all, because you see it, 5 years dreaming and working. Yes, so Touch's SABCS event, which focused on patient navigation, right? This is how people describe patient navigation after the panel. This panel coming up next will be moderated by the phenomenal Valerie Worthy, and each panelist will do their brief introduction. Come on, Miss Valerie! Make some noise, y'all. Listen, like a fan, y'all. Miss Valerie. And we're gonna do a little video before Miss Valerie gets in. Hey, girl, you look so nice. So we're gonna do the video. Perfect.
My name is Ricky Fairley. I'm the CEO and co-founder of Touch, the Black Breast Cancer Alliance. I'm a 12-year survivor of triple-negative breast cancer.
Hi, I'm Valerie Worthy. I am co-founder of Touch, and I am so excited just to sit here and talk to Ricky. I am a 25-year breast cancer survivor.
And we are here to help patients with managing their clinical trial.
So, Ricky, let's talk a little bit about a clinical trial, because I think people have different ideas of what it is through the lens of a patient. How would you describe what a clinical trial is?
I would describe a clinical trial as taking a medication that's not already available, and I kind of view it as the best science we have, right? I did a clinical trial because my doctor told me that they didn't have any more drugs for me, but I think everybody just should consider one because it's really the best science we have. It's a medicine that's in test. I know that I'm not going to get a sugar pill. I know that I'm going to get standard of care, and I'm going to get maybe a drug that's even better that's not currently available. It's almost like getting the drugs of tomorrow, and so I think it's a really great thing. we at Touch, we try to be iconic in how we provide for our patients and try to do things that other people aren't doing for our patients and make a difference in how they're, dealing with clinical trials and understanding them. So I'm so excited to talk to people about what we have to offer.
I think it's exciting because I really see the need for navigation. 25 years ago when I was diagnosed, there wasn't a term navigation. And so patients really felt like they were alone, especially after 5 o'clock. And I've noticed that that's when you get all of the questions and there's really no one to talk to, especially if it's not always side effects related. It could be like community resources and community advocacy that they may want to tap into. There's nobody to answer those questions. So I'm just so happy that this is something that we can offer our community.
Great. So what are we actually going to do? What's going to happen? You're considering a child and you're thinking about it, and what are we going to do for you?
So I think the beauty is that you can say, if you think about navigation, our Touch Care being an extension of what you're receiving in your cancer center, that means that you're getting 24-hour coverage. Now, who gets that? Absolutely nobody. So after 5 o'clock, when the doors of the cancer center are pretty much closed and people are trying to go home to take care of their families, if you have a question at 5 o'clock to 8 o'clock the next morning, we are available. And for the most part, most cancer center personnel don't really know about what community resources are available. And so we're there to make that connection, to walk with you through areas of your life that sometimes aren't even discussed. But because we're survivors, we've been through this thing,
Right.
We know. We can kind of anticipate problems that patients may have, and maybe we can circumvent, the pain or discomfort that they go through because we know how to work through it.
Yeah, we know what it feels like, we know what it looks like, and just knowing how we feel, knowing how I feel, knowing how you feel, it's just a blessing. So Val, when I was sick, all my friends came to take care of me. None of them were cancer survivors, I didn't really understand, but they created this haven in my bedroom. I think with Touch Care, we try to do the same thing. And so to me, it's like a big cozy blanket that we're just gonna wrap around you, and everything is gonna be inside the blanket. I just want a hug. I want somebody to take care of me and just tell me everything's gonna be okay today, in this moment.
Right, because it's so frightening and there's so many unknowns, and it really is. But what they do know is that Touch Care will be there.
I'm so happy that we can provide this service to our patients. I'm so happy that we can do that, and like we can only do that because of you and your brilliance. So I love you, Val.
Working together, we make a wonderful team.
We do.
So before as our team is coming up, it's two things I want to say. Ricky and I, on the first Saturdays of each month, we have a virtual support group that we just engage wonderful conversations with. And I just want to say hello to them because we don't get to talk to them like personally this morning, but our hearts are there and I hope you guys can see us. And then secondly, I want to add just a little bit more history to patient navigation. As history is being trying to be changed and literature taken out of places where it should be, I just wanted you to know that patient navigation would have never started without a surgeon in Harlem, Dr. Harold Freeman. And what he saw was that there were a lot of African American women coming to his clinic and they had late-stage disease. And he thought, what could I do to make that difference? And so he was the one that trained community navigators to go out into the community, to find these women, to identify barriers, to eliminate the barriers, and get them into the cancer centers so that they could get timely care. And so when you ever think about, oh God, somebody else even create the idea, Harold Freeman, an African American surgeon, really made a difference in the lives of women. So, hello ladies. Oh, briefly introduce yourself, and then I have a few questions, and I know you have wonderful answers for all of the questions. So, where do you want to start? Val, you want to?
My name is Valerie Blackwell Howard. I am married. I have 3 children. I have 3 grandchildren. I am stage 2 triple negative breast cancer survivor, and I'm also ordained elder of the church. So I'm just here to give my support to my community.
I'm going to switch the mic because I couldn't get that one on. I'm Sue Weldon. I'm the founder and CEO of Unite for Her. I'm actually a 21-year survivor tomorrow. And the 4th. My kids when they were little used to say, "May the 4th be with you, Mama." They still do that. They're in their 30s. So, but I'm happy to be here. That touch care, I mean, that is, I know we'll talk about that a little bit more, but to be able to lean in with another nonprofit and collaborate in such a way that can make such a meaningful difference. And I have to say, watching that video of 5 years of what Touch has done in 5 years, you've done more in 5 years than people do in 20. So a round of applause for the Touch community. They're like moving and shaking. We're stopping you now, right? I love it.
Hello, everyone. My name is Whitney O'Connor. I am a licensed professional counselor, a national certified counselor, founder and executive director for the Booby Queen Company, and also 2-time breast cancer survivor. Thank you. I was diagnosed when I was 30 years old, 6 weeks after I just got married, and found out I have a rare genetic mutation called Li-Fermini syndrome, and then had a recurrence 2 years later. So started the Booby Queen Co. in the midst of all of that fun stuff, and we focus on mental health because that is something that we feel has been neglected in the navigation process with patient care. So that is what we do, and we love to wear bras on our heads because life is hard enough, and why not? You know, so yeah, that's me.
Love it. So you heard a little bit about the definition of what patient navigation is, but in clinical terms, it means that it is a patient-centered intervention, meaning we do something that's really related to the patient. So it can look like different things, just as you've seen our panelists here explain who they are and where they are. Patient navigation has that same type of context. So for example, in 2009, when I worked specifically in the community, I was considered a community-facing navigator. And then a few years later, in 2014, I'm a registered nurse by trade, I was a navigator inside of a clinical setting, which for me was a different kind of look on navigation. Still patient-centered, but it was a different context. So ladies, my question is, what is navigation to you?
For me, navigation is going into the communities to connect with less unfortunate that have underserved communities to assist them in their health care, especially breast cancer, because I am a survivor. So I go into the churches, the house of worship, and I go into women groups to educate and support and encourage women that are going through breast cancer or that may be diagnosed sooner or later with breast cancer. So I just try to communicate with the community in an overall setting.
So can you talk a little bit about church and church folk? And this is my thing, y'all. I love Jesus. Yes, I do. But this is it, and I gotta be transparent because that's the kind of person I am. If I say I love Jesus and I am a believer and I was diagnosed with breast cancer and I am now healed and I keep it to myself, how do people know that the Jesus that we serve is a healer? Can I just understand that? I don't actually be a nurse, a doctor, or even a navigator. Just tell your story.
What made me become an advocacy, not only having breast cancer, because when I was first diagnosed, I would always say that God told me, first of all, that I would not die and that I will live. And
Yeah.
I was gonna have to go through what I had to go through. But in the process during that time, I was in church. I was in church. And I went to church every Sunday. My hair was falling out. I wasn't feeling good about myself. And there were several women in the church. And not until I finished my treatment, that they came to me and said, you know what, I have breast cancer. And these ladies had been survivors for 15 and 20 years. And I was just diagnosed in 2018. So I'm coming to church weak and hair falling out, not feeling good about myself. And no one never came to me to give me encouragement. And I was like, I cannot live this way. As like you said, as a Christian, being a Christian and being in church. So I tried to go into the churches every day. I have started women groups inside the church. And I also have started in other churches where I go to the ministers and say, can I come to your women ministry and speak about breast cancer, because it's not being talked about in the church. First of all, we're not talking about health in the church. We're always talking about prosperity and what we can do, but no one talks about health in the church. So I go into the church, I go into women programs and talk about church. I talk about how women can take care of their breasts, how they can take care of health, not even breast cancer, just overall health. Right. Because we are dying of health, breast cancer leads to cardiovascular disease, to diabetes, to all types of disease. So I'm looking right now to start, I'm part of another organization called Triumphant Christian Fellowship, and where I have just begun to start a facility where we can go into a health orientation, go into the churches and go and let them know that, you know, when there's help outside of the community, there's help inside the community. I go to community basketball events. I go to the schools where they allow me to go into the school for the younger. I have a 20-year-old granddaughter, and I have her come to events with me so she can give back to the younger 20-year-old, 18-year-old, 17-year-old, because the church is not doing what they really supposed to do.
And all this is navigation.
Healthcare, exactly.
Yeah. Thank you. It would have been great if Valerie had known about, you know.
Yeah, for sure.
So talk a little bit about that.
Yep, she was part of it.
Yeah.
So Unite for Her, we fund and deliver integrated therapy. So think about medical acupuncture, yoga, massage therapy, fresh food sent to the home, vegetables, nutrition consults, sexual health, fitness, right? We have all of these wraparound services that help women do better on their treatments, on their plan, help them adhere better, help them manage their side effects and symptoms better. We fund and deliver that. We are now serving over 10,000 individuals across the nation with the program. We've had a big growth spurt, but navigation is in every part of that. It looks different. There's nutrition navigation. There is counseling and mental well-being navigation. There's financial navigation. Navigation happens in so many different ways, and it's like, Valerie, you're like our quarterback, right? Like you're in there giving all that information out to that team so they know what's available, the breast cancer community team. So they know what's available to them, because sometimes you just don't know what's out there, right? And then that it's funded and delivered. It is what I lived all those years ago. I was fortunate that I could lean into these types of treatments, and it helped me tremendously. A lot with my side effects and symptoms, and hormone management, and bringing my periods back when I went into menopause at 39, and then acupuncture brought me back. I wanted to have more children. These are things that weren't talked about, right? But it was something that is science and research based. And that's where we have this place. But navigation looks like all of those things, right? It's not just one area, because what works for you might be different for me, it might be different for you, but we all have the final outcome, and that's feeling better physically, emotionally, right, mentally, and able to actually take control in a disease you had no control over. And that's where navigation, is elevated, and you feel like you've won, right? When you feel like you can be a self-advocate, right?
And also with the patient navigation, I also, every day on a daily basis, I get in touch newly diagnosed breast has been in touch with me, so I'm on the phone 24 hours a day, supporting and encouraging, and also trying to provide resources to these individuals. And if I don't know the answer, I have 20,000 people I can call to get in touch to help these young ladies that are being diagnosed with breast cancer, because oftentimes they don't know where to go to or who to go to. And part of being a navigation, it's like you said, self-navigating, to help just individuals. You don't have to be a big organization to help others.
Yes, absolutely. So, quick, mental health, oh my God. So, cancer is already a stigma in the faith community. I can't even begin to tell you what mental health does and how mental health is so impactful. Like the way a woman thinks once you're diagnosed and how those two things interplay. Can you talk a little bit?
Well, it's such a physical experience.
Right.
Going through treatment is a very physical journey. And because a lot of us, when we go through the physical journey, we don't have enough room to think about how we feel about it. And so we're just trying to check boxes and get it done. And that's exactly what I did. I checked my boxes, I got it done. And then a year later, I had all kinds of issues figuring out my new identity, figuring out my relationships, figuring out my job, trying to figure out how am I gonna have children, all of those things. And so for navigation for me is like a playbook. It's a process where you literally pick a playbook that's gonna help you understand your journey specific to you and what your needs are. And with mental health, I'm a therapist, you guys, okay? I'm a therapist. And a year after I was done with treatment, I was really struggling. I'm a glass half full kind of gal. I'll wear a bra on my head, I mean, come on. But I struggled. And I felt like I was a bad survivor. I thought I was doing it wrong. And I found out I wasn't doing it wrong. There's actually a lot of women, that are experiencing all of these mental health issues in treatment and after treatment, and sometimes for years after treatment. And so navigation is just super important in figuring out that process and trying to become a queen and remember that you're a queen after all of this physical stuff that you had to go through.
I love that. When you think about navigation, as we've outlined here, all the different things that navigation can do for the patient, but how about other patients and other people that come alongside us to help us? And as a clinical navigator, I remember many times I literally drew diagrams for patients because they did not know how to navigate care people, the people that wanted to take care of them, from friends to family to co-workers, and they were even struggling with, how do I say something that's not offensive and then that person gets angry with me? So everyone, I think, needs somebody to help guide them. So what other opportunities do you think that we could use navigation for, other people that we could use navigation
For our caregivers. Speaking of our caregivers, caregivers are never given the tools to how to effectively care for their loved ones. They just pick up the barrel and go headstrong, but they don't know what words to say to them, how to comfort them, how to speak to them, because they are never given the tools. So being a patient navigating is very important, even to the caregivers, and even in the medical, for healthcare, because I, as a breast cancer survivor, was never given a social worker. No one told me how to live with breast cancer. Like you said, all I did was check the boxes too. I went, check, I got this, check, I did this, check, I did that. But nobody came to me and said, Valerie, I can give you a social worker, because I was going through a body image thing. I didn't want to look in the mirror. I covered all my mirrors. I would run past my mirrors and come back because I didn't want to look at myself in the mirror. And this is real. But no doctor, no one connected me with anyone. I had to figure this out on my own. And I think that we should give that information to our caregivers and loved ones, even the medical field, because they don't even tell us how to communicate with our doctors to effectively communicate with them, because they just want to put us in the office and want to throw us out.
Absolutely. I remember when I was diagnosed and I shared with someone that I just been diagnosed, and they said, "Oh, my aunt died of that," because people don't know what to say. And so I learned a few months after hearing it by every other person to say it in a kind way. I know you're thinking about me, and I know that you are saying what you think is of comfort to me, but it's not. So let me help you help me. Just say, girl, I don't know what to say, but I'm praying for you. That'd be enough for me. And that's what I did. But again, having a navigator, as you said, will help people to really help you. And that's not what's available right now.
Or they come to you and say, "Oh, you're strong." Don't call me strong, because I'm not Superwoman.
Yeah.
Don't, like, I'm not Superwoman, and so don't put me in that category, because I have weak moments.
Yeah.
And I need someone to help me navigate through those mental, attitudes I have.
It's a language
Right.
that we're missing.
Right.
We're having apples and oranges conversations. And so instead of having apples and oranges conversations, let's just have a language that we can all speak and navigate this process together. Even if, with a doctor, and I went to my doctor several times going through medically induced menopause, still in medically induced menopause. And in fact, Anitra last night rescued me because our room was so hot. And she goes, "Girl, I got a fan." I said, "Oh my God." It's always better to travel with other survivors, I'm just saying. Oh. But anyway, so still there. And you were mentioning discussing health in church and mental health and just trying to come up with those things. And this is how I explain mental health. If you were going to get into a car accident, and let's say that you broke your leg, what would happen next? You would go to the emergency room, right? And you would get seen by a doctor, and they would probably give you some crutches, right? They would probably say, "Oh my gosh, you're going to probably have to have surgery." So they're going to refer you to a surgeon, an orthopedic, and then they're going to give you a plan, right? Like, you need to, in 8 weeks, you need to do this. In 12 weeks, you need to do this. And in a year, you should be back to normal, right? So no one would let you just leave the emergency room with a broken leg. And you probably wouldn't go home with a broken leg, would you? Because you couldn't live your life. You couldn't drive, you couldn't handle your business, none of that. Well, it's the same thing as mental health. It's just on the inside. And so, this physical experience is so much on the outside that I think navigation is missing what's happening on the inside, which is scary for people to talk about, because we're talking about feelings and we have to be vulnerable and all those things. But they're both connected. Because I'm going to be a better wife, I'm going to be a better friend, I'm going to be a better daughter and sister and all those things if my insides can manage all of these things and recognize my resiliency of what I just went through physically. So that's a way to explain mental health to someone that is having a hard time understanding those two things, physical versus mental.
So Sue, what the social worker and I found out was when we began to call the patients or care for her, our entry was to talk about Unite for her. But what they did share with us was the many services that they didn't know about, and being able to get that massage or even knowing about the right things to eat. I mean, that was just amazing to me how impactful it was for them. And then they came home and told their caregivers about it. Right? So tell me, what made you all decide what services you thought would really impact cancer patients?
Let me go back to that the way that you're approaching Care for Her too. For those of you that might not know Care for Her, we pretty much align our two nonprofits together. What would happen if we gave integrative therapies along with nurse navigation? Would our Black breast cancer patients do better on treatment, adhere to treatment better? Would it move the needle to that 41% that we're hearing? If they knew that they could have this access. And the fact that you talk about, like nurse navigation talks about all the things that might be uncomfortable. If you're diagnosed, it's a trauma. We should not feel like it's not a trauma. That would not be normal, right? So if we can lean into it and it's normalized, and the more they hear about it, it's like clinical trials too, and everything you are doing with that, it's becoming more a part of the conversation. And that is what helps people then lean in to see if they can get access to maybe some therapies like sexual health that they really want to talk about, or the counseling, right, or the acupuncture. So when we talk about the wellness passport, it's a passport of $2,000 worth of services. It's what I lived. It's all those years ago. I didn't realize I was building the business plan for her. I was just trying to survive, but I ended up having really incredible individuals, women, come to me and teach me a 5-minute yoga routine that was power of breath and movement, and not the yoga you pull your foot up over your head and wear those cute pants and sweat it out, right? Like we're talking about just sitting here. We could learn how to quiet our mind, because I had so much negative chatter that wasn't going to come back. And then all of a sudden that gave me a tool. I had a tool in my toolbox. Then she told me about acupuncture. And it was for depression, not for like the pain and the hot flashes it was for depression. And that is who told me, Susan, you have every right to be depressed. That is a normal response. And the weight that came over my shoulders of just feeling like I can now admit to that. It's okay that I'm feeling low and that they're gonna meet me where I am. What occurred that year is I did 36 treatments of acupuncture. I did all of this, yoga. I leaned into nutrition. I changed my diet that it was more plant-based forward. I was trying to find tools. I was trying to find anything I could hold on to. Getting the toxins out of my bath and beauty products, right? I'm looking at my children and trying to understand, how am I going to be here to raise them? On my knees all the time, praying about how did I get here? But this gave me tools. It gave me a plan, right? And that is what started the passport. And when we developed Unite for Her, it really was a year later. I was at an event on the Art Museum steps in Philadelphia, and I saw a woman out of the corner of my eye, and her hair gone, yellowish tone of the skin, hollow eyes, and I'm like, oh, that's me. Let me go up to her. Let me share everything I did so she could do it too, right? Like once you know, you want to share. And I went up to her and I shared, and she cried, and she said, oh, good for you. I could never afford all that. I was like, oh, shame on me. Right? That was my moment. I'm living in my little community, I'm raising children. I didn't think like, oh, healthcare is not equal. Oh, right, access is not equal. And that is when that light bulb went off, and I'm like, all right, honey, I want to start a nonprofit. I'm not quite sure what it looks like. We're all gonna have to work for free and raise a lot of money, and you're gonna be on the board, and we're gonna figure it out, right? But it was like just, and then we slowly started adding more and more. Like my acupuncture was my counseling, but we had sexual health and professional counseling, right? Nutrition, I learned a lot from acupuncture as well, an Eastern type of philosophy, but we have these nutritionists that are registered dietitians that lean in and teach us about food and medicine, teach us about, we call it potty talk, but how to manage side effects and symptoms like diarrhea and constipation and things that leave you debilitated. So it's all of these different types of approaches that usually are out of pocket that we fund and deliver. Once you get those tools, you become empowered. Now you want to do more, and that was how I felt. Like once you learn something's working and you can control it, unlike cancer, unlike getting led around by a lot of physicians, it's very hard to gain that control back. This gave control one step at a time, and now they become advocates, and that's where together, like. Again, you're that quarterback. You are saying, okay, this is what I want you to look at as far as some resources that you might not have thought about, and we'll cover them for you. And that's where the two nonprofits can work so well together.
Absolutely.
Yeah.
you get that out to your community where you are? How could you promote what Val does, Sue does, Whitney does? How would you do that?
I usually call on Touch, Unite for Her. I call everybody. And I can tell you something, I live out in my community. I am not afraid to pick up the telephone and call and make a phone call and say, I don't have the resources, because sometimes the resources does come out my own pocket. But when it comes out my pocket, I say, you know what, I have connections. So I call Touch for the love of my girls, I call United for Her, I call everybody.
Great.
We call you.
And I'm saying and I just wanted to say one thing, because even when you was talking, I want to talk about mental health just a little bit more, because I just was speaking to Blessing, she just finished her treatment. And I was on the phone with her for maybe about like 2.5 hours Thursday night. And she kept asking me the question that no one have given me an answer for, and I ask this question every day. How do you live after treatment? Nobody have ever told me how to live after my treatment. And I was on the phone with this woman for 2.5 hours telling her, wow, I had that same question for myself. Because I had to, every day I had to learn how to love myself and how to, and on top of that, how to help others, because it was my God, like Ricky said, my God call to God job, right, to help others. But in helping others, I learned that I was able to help myself by giving back to the breast cancer community, because nobody never told me how to live after breast cancer. And I was a vegan for 10 years before I got breast cancer. So I was running marathons. And I was like, nobody told me how to, I thought I was doing it all. But
That's so funny that you asked, because Whitney and I had a conversation about how do you do this thing after you had your treatment?
Like a queen.
Yeah.
Well, the thing is, we go through this process, and then we ring a bell, and we're like, woo, we're done, we did it, we did all the things, and then we're standing in the living room, staring at the wall, crying, hot, wondering why we're here, and that's just, that didn't happen to me multiple times, but we're wondering who this new person is. And what do we say? We always say, I just want to get back to normal. And so that idea of getting back to normal is actually hurting us, because we are different. But how do you do it as a survivor? You celebrate the difference. And even though we have to grieve and mourn those things that we can't necessarily do anymore, which I don't even say that anymore, y'all. I don't say I can't do it. I say I'm retired. Like, I can't, drop it as low as I could before, but that's because I'm retired from that. It's not that I can't. And that language is so important. How we talk to, like how you were saying, how we talk to ourselves is so important. And so afterwards, as a survivor, I am not back to normal, and I don't want to be honest with you. I have learned to embrace my flat chest. I've learned how to embrace the 40 extra pounds that I got from treatment that I can't seem to lose. I learned to embrace the difficulties with my amazing husband, where we were navigating something completely new that we've never encountered before. 60%, you guys, of marriages of young survivors end in divorce. 60%. And so that's why Sue has stuff, that's why we have these navigation systems, because there's different portals we gotta tap into. So anyway, it is a difficult question to answer how you do this afterwards, because we're so dedicated to how we did it before. But if we had a language, and if we had a plan for your mental health, then it would be a little bit easier to understand what's happening to your body instead of being mad at it. A lot of us survivors we have a lot of shame. We're mad about how we look. We're mad about how we feel. We're mad that we're this burden and inconvenience, and oh my gosh, she's talking about her breast cancer again. Like, that stuff all happens, which is why we started a community. That's why we need each other, everybody in this room. That's why we need each other. That's what I tell people, like, I need you just as much as you need me. There is no competition. Me and Ricky talk about that all the time. There is no competition with other advocate groups and nonprofits, at least in my eyes, because we need each other. And the mental health component is, PTSD is known as the invisible wound. Did y'all know that? It's the invisible wound. And when you think about PTSD, a lot of people just associate it with soldiers, right? But we all got here in a different way, but guess what? The feelings that we're experiencing are the same. So y'all know exactly what I'm talking about when I'm talking about my hot flashes. I mean, the survivors do anyway. So that's the thing to remember, is that even though we got here different ways, the feeling is the same. And that's where we need to start with our navigation, is we need to have a shared language. Instead of you talking about apples and I'm talking about oranges. So.
Totally right. And I think that the space that you're talking about is survivorship, navigation.
Yes.
Which we have very little of that. And there used to be a time that when you were complete, when all your treatment was done, you get what we call a survivorship care plan. But now that's optional, so people don't know what to do.
And there's a lot of shame too. It's like, if I'm 30 years old, I did the things, look at me, I'm wearing the tutu, and I got the boa and all that, I got my crown, so I don't need things anymore. I want to show everyone that I can raise my kids, I can still be a professional, I can still do all those things. There's so much shame around it, and so if we can eliminate that, then we can embrace the BB Queen life.
And we talked about all types of navigation. So you guys see that there's navigation in the community where we can help people get screened before they're diagnosed. And then that community navigator can do that warm handoff to that person that's inside the cancer center. And then you also have what we call treatment navigators. And they're the ones that kind of teach you about the diagnosis and side effects and hopefully how to deal with your family, your community. But then when it's over, it should be a survivorship navigator that's saying, if you have this pain or discomfort for over 2 weeks, you need to call your doctor. All of those kinds of things. If you feel like mentally it's not working for you, you need to find some help. But we don't have that. That's where that part is missing. And guess who needs to advocate for that? Those of us that are survivors. Because if we can do that, some cancers, returnable cancers, can be caught much sooner. And when I look at, some people, and I'm gonna have to say this again, my transparent moment, I think sometimes people don't care what we're going through, but they care about the dollars that they save. Does that make sense? Okay. So with navigation, if we catch these things earlier, then they save dollars. So sometimes, even though I love to hear the stories, because they're like, they touch my heart. But there's some people that don't give a rat's you know what about our stories. But if we say we save money, they'll listen. So maybe we need to find a way to save the boat so that the people that fund this, right?
It's all your metrics.
All
You're
the
very good at
metrics,
it.
yeah. So final question, and this is to the audience. Do you think that you've learned enough in these few moments about navigation and that you could fight for navigation, maybe not for yourself, but maybe for a family member? Raise a hand if you feel a little bit more comfortable. Hey, that's pretty doggone good there. Can you join me in thanking our panelists? Thank you. they wanna get